some of you may not be used to my accent from New Zealand, and I do tend to speak a bit fast. So please, if you don't understand or I'm speaking too fast, feel free to let me know. You can type a message in the box, or you can type a message to Dr. Dixon, and he will let me know. As he said, I'm in general practice in Australia. I'm by no means an academic. I'm not a specialist. I don't have any special interests. And I don't own my own practice. I'm just working for my bosses. But what I can offer, I guess, is 10 years of experience in general practice. A lot of cats and dogs and other animals as well. And so I'm hoping that you'll be able to pick up a few things, including some practical tips and help as you do your practice in India. So the flow of this lecture will be more suited to like a consult. So we're going to talk about the presentation of Otitis Externa, how you would treat it, what you would do, and go from there. So, okay. So let's just start with the anatomy of the ear canal. So you have the external pinna, which is the ear flap like this. In many dogs it stands upright, other dogs it's floppy. It's held up by the auricular cartilage inside the ear like this. And then you have the ear canal. Now you start off with the vertical ear canal, which goes down towards the ground like this vertically, and then it turns the corner 90 degrees to go in towards the skull, and this is known as a horizontal canal. That L-shaped or 90 degrees bend is really important, as you'll see coming up. And then at the end of the canal is the tympanic membrane or the eardrum, and this all comprises the outer ear. And this is what we'll be dealing with in Otitis Externa. Continuing with the anatomy, the middle ear comprises of the middle ear cavity, the tympanic bulla, and the auditory ossicles. So the malleus, the incus, and the stapes, these three little bones sitting against the eardrum and connecting to the cochlea and the semicircular canals in the inner ear, which is situated in the petrous temporal bone, the hardest bone in this body. And these will conduct the sound waves into nerve impulse into the brain. And often I think of these, and they're so small and so intricate. And I always think of how God puts everything together in such an amazing, detailed way for us to be able to hear sound and voices and music. And I just praise God for that. So that's the anatomy we'll be talking about today. Okay, I also was going to say that I am going to be asking some questions to you all. So yeah, if you'd like to unmute yourselves and answer them, or even type in the chat box, it'll just be good to get a bit of interaction going on. Yeah, so we can just get to know each other a little bit more. Okay, so let's just say you are presented with a dog with Otitis Externa, or inflammation or infection of the external ear canal. What are the clinical signs that you would expect to see? Can anybody unmute themselves and tell me what clinical signs you would expect? Or even type in the chat box. Yes?
Can I answer?
Yes, of course. Yes, just say.
You probably have head tilting,
yes,
if it's unilateral, or depends on bilateral, and then there'll be shaking of the head.
Yeah.
And
good.
Maybe if there's pruritus, there'll be itching and visible signs of injury if the animal has been
good.
for a while.
Very good. Anybody else? What other clinical signs? Thank you, Samantha.
There might be inflammation.
Inflammation, yes.
Around the ear, which and there might be some pustular discharge.
That's right, discharge.
Bacterial.
Yep. That's right, discharge and some smell. Very good. So yeah, we've got it here. So head shaking, pruritus, red ear, discharge or odor, and as Dr. Samantha said, sometimes a bit of a tilt. If they're just a bit sore, they will put their head down to one side. Often if they've got a real big tilt, you wonder if there's a middle ear infection, or if it's gone into the tympanic bulla as well. Less common signs of an ear infection, but to be aware of, is an oral hematoma. So this is when the animal has scratched himself so much and has caused bleeding in the pinna between the skin and the cartilage. And because the blood has nowhere to go, it forms a bit of a hematoma, so a collection of fluid. And the owners will often come and say there's a lump or a bubble in the ear. And if you see this, you must check for an ear infection as well. And in the same way, if they come with a hot spot, so a rash or a wound, mostly behind the ear, sometimes in front of the ear as well, if you see that, you should not just treat the skin infection, you should always look in the ear to make sure that there's no infection in there. So the first thing that you want to do after talking to the owner is that you want to take a look with your otoscope. So techniques to do this, remembering the anatomy of the canal, you want to point the tip of your otoscope down towards the ground first, like this. And when you hit the bottom of the vertical canal, you want to do a 90 degrees tilt and then point the nozzle towards the skull and then push it inwards to see if you can see the tympanic membrane. It's often good to practice these on anesthetized dogs because sometimes dogs with ear infections are a bit painful and they won't let you do this. Techniques to do this safely, because obviously you're around the head of the dog and that's where the teeth are. And if they're painful or aggressive, they may tend to bite. So what I usually do is, I'm right-handed, so I'll hold the otoscope in my right hand, just like this person is doing. With my left hand, I'll lift the ear up, the ear flaps up, and I will push the nozzle of the otoscope vertically down towards the ground with a little bit of tension. So one hand pulls up, one hand pushes down, just gently wiggling it all the way. And see how her arm here is sort of bent a little bit like this. I actually bend my arm even more and I push it against, right contacting against the mouth of the dog, just so that if the dog decides to turn and bite me or look at me, it's actually going to just push my arm out of the way. He can't actually turn and bite me because my arm is physically against his mouth. And similar technique on the other side. The way I get the owner or my nurse to hold is like this. So I usually will say, please hold the nose towards you, so putting a bit of pressure to hold the muzzle away from me. And then I'll get them to put either a hand or their arm, usually a little bit more caudal at the back end here, so that the animal can't wiggle backwards. Often they'll try and go backwards and get out of the way. So holding them like this is quite a firm and practical way to deal with examining. So can anybody unmute themselves and tell me, what are you looking for? Why do we do otoscoping? Anybody want to know why we bother doing this? Yeah.
I'm just, one is to check for inflammation.
Yes.
Then to check if the tympanic membrane is intact.
That's right. Good.
And maybe just check if there are other growths or any.
Yeah. Yeah.
Something obstructing the canal.
Yeah. Sometimes there's masses or polyps in there.
Yeah.
Very good. Anybody else? Got any ideas of what we're looking for when we do this? Yeah, so as Dr. Samantha said, we want to check if the tympanic membrane is intact or not, if it's there or if it's damaged. It's great if you can see it, often you can't, and we'll talk about that later. You want to see if how much wax there is in there. You might see some mites. So if you're lucky, you'll see mites running away, and then you'll have your diagnosis there, or at least half your diagnosis. You may see a foreign body in there, so something that's lodged into the ear and causing them to have that pain and infection. So it's really important to take a look just before treating. And after that, we're going to take a swab for cytology. So again, when we take the swab, we're going to use a cotton bud or a Q-tip, and we're going to place it just into the vertical canal like this. So we're going to pull it all the way down, wiggle it all the way down so you can't go anymore. We don't need to turn the corner and go right into the horizontal canal. All we need to do is just get to the bottom of the vertical canal. Sometimes if you take a swab and it's too superficial, you won't get a representative sample of the pathogens that are in there. You need to go deep into the canal as much as possible. And then you want to roll the swab onto a slide, just gently like this. Label it one for each ear, or if you're lazy like me, you just put the left ear on the bottom and the right ear on the top, and then you can look under the microscope. Okay. So the most common foreign body in Australia and New Zealand in the ear is actually a grass seed. I'm not sure if you have these in India or not, but they're just the sort of tops of the grasses, and they look like an arrowhead, and they can work their way really nicely into the ear in one direction, and then they can't get out. So if you're lucky, and if the dog is unlucky, you'll see the grass seed like this, next to the tympanic membrane. Often there's a lot of pus, there's a lot of discharge, there might be blood, so it doesn't look as clean as this, but you might be able to see it. And if that's the case, your best bet at getting it out is to use an alligator forceps that looks like this. So it's got a nice long tip, and at the end here it's just got some little some teeth that can grab it and take it out. So it's worth investing in one of these if you are seeing a lot of foreign bodies stuck in the ear canal. You've got to be careful though, because obviously it's something metal when you're going very close to the eardrum, so you don't want to puncture the eardrum with the alligator forceps. So if the dog is calm and good, then you're able to get it out, that's fine. But if he's too painful or shaking his head a lot, you should sedate or put under general anesthesia and be able to take it out safely. Okay, cytology. Can I get an indication of how many people have access to a microscope or do cytology? Even if you just type in the chat box cytology or microscope there for me, or you unmute yourself and just say yes or no. Good to know. Do you have access to microscopes? Anybody? Yeah. Yes. Okay. People aren't sure. Yeah, okay. So if you do have access to a microscope, cytology is a really great tool. It's pretty easy to do and just takes a little bit of experience to learn. So I really encourage you to be able to do that. So once you've made your slides, if you suspect mites, you want to use mineral oil. Just place a little bit of that on your slide and cover it with a cover slip and look under the microscope. For yeast, bacteria, and cells, you want to use Dist stain. So this should be available in India. You've got your fixative, which is alcohol, which just fixes the near onto the slide. Then you've got your stain number 1, your stain number 2. So 10 times dipping in each one, 10 times, and then washing it with some water afterwards, and then either air drying it, or we usually dry it with a hair dryer, or sometimes you can use an open flame to dry it, and then you look under the microscope. So what are you looking for? Oh, actually, so for those of you who don't have access to a microscope and can't do cytology, the colour and the nature of the discharge is not a reliable way of telling what the infection might be, but you can make some guesses based on the discharge. So when I was at vet school, we got told that if there's ear mites, if you don't see the mites themselves, you might see some coffee granule type discharge, which might give you a clue that there's mites going on inside. So discharge like coffee granules. For yeast, you'll often get a really dark discharge, and it has a very yeasty smell. I'm sure you've smelled yeast from dermatitis on the feet, or maybe around the back end on the belly. So the characteristic smell and the discharge often looks like this, very brown and sort of moist. And with bacteria, particularly Pseudomonas, which we'll talk about later, you'll often have purulent discharge, so pus, and we always liken that to cheese. So if you've got lots of cheesy discharge coming out of the ears, you have to think about maybe these bacteria going on. But if you can take cytology, you definitely should. Okay, so looking under the microscope, mites, Otitis Externa, will look like this. They're quite characteristic. It's hard to miss them, and you don't need to use a high-powered lens. Probably just 4 times or 10 times is going to be good enough. These are just squames, so they're just dead skin cells, or maybe some wax or some debris that get caught up in there, so that's nothing to be too concerned about. Okay, can anybody please tell me what these are? These dark, round, well, bilobe shapes. Anybody unmute themselves and say? Perhaps type in the text box if you want.
Is it? I'm not very sure. I could be wrong. But is it Malassezia?
That's right. Yes, right. Yep. So it is.
All right. Yeah, I remember that shape from uni.
That's right. Exactly. So Malassezia pachydermatis is the yeast that we find in the ear typically, and they're quite easy to recognize. They have a shape like a footprint, like this, or I don't know how many of you build snowmen in India. I don't build snowmen in Melbourne, but like a snowman, a little two bubbles like this. So they're quite easy to see, and they're also quite large. You can also see them on a 40 times thing from between your eye. Okay. Can anybody tell me what these are? You want to see those? They're going to mute themselves and say what those ones are. Yeah, they're a bit smaller than the any guesses?
Bacteria, coccus bacteria.
That's right. That's right. They're cocci. Very good. If they're stuck together, diplococci, maybe chain cocci. That's right. So cocci, staphylococci, your main offenders there. And what about this one? Can you get it up? These ones. Can you see that? You want to tell me what those ones are? Can you tell me who was the cocci? They're also quite small, probably the same size as the cocci, but they're just a different shape. Yep. Oh, I can't hear you very well. You might have to mute yourself. So those are rod bacteria, okay? So with rods, you are thinking of either Pseudomonas, E. coli, or Proteus species. These aren't to scale. These are the bacteria are a lot smaller than the Malassezia, but it's just good to look at here. Cytology is something that you learn by just looking. I really like cytology. Sometimes I don't know what I'm looking at or what I'm looking for, but I know that at least I'm looking at something, and the more I do it, the more I know what's normal and what's not normal. So it's a great way to be able to teach yourself and look things up and learn. It's fun as well. All right, let's go on to treatment. So your treatment in general, yeast and cocci are pretty easy to kill with a simple infection. Rods are harder to kill. So that's why it's useful to know what you're dealing with. We always treat with topical treatment, so down into the ear. Systemic antimicrobials are not very good at all, so it's no point doing those unless you actually have to. For mites, general parasite treatment will be fine for that, and we'll talk about in a second. And then for severe cases or ones with a lot of wax and a lot of discharge, I'll use ear cleaner, either once a day or every second day, every other day. And you want to do it at least 30 minutes before putting the medications in, because you don't want to put the medications in and then wash them out with the ear cleaner. And for bad cases that have a lot of inflammation and pain, I'll often put them on oral steroids. So oral prednisolone, 0.5 to 1 mg per kg per day, can be in divided doses, morning and night, 3 to 5 days, and then maybe taper them off. So I'll give them the tablets as well. We have combination products here. So this one's called Demotic. It's got a antifungal, antibacterial, and steroids in it. This one has antiparasitic for mites and lignocaine, as well as antibacterial, antifungal. So these are good. If you can get hold of these and use them, that would be great. Otherwise, we're going to talk about other treatments in the session. So for ear mites, the two registered products that we commonly use are Advocate and Revolution. So imidacloprid and moxidectin, and selamectin. These are applied on the back of the neck once a month, and these will do your fleas, heartworm, your mites, including your Sarcoptes and Demodex, and your roundworms. The only thing they won't do is tapeworms. So they're really good products, and I think you're able to get them in India as well. I know you use a lot of ivermectin in India, so this is also fine to put inside the ear. I guess it's off-label. You can get hold of some injectable ivermectin. If you use the 3.15%, then the dose rate is 2.5 mg per kg into each ear, and repeat in 2 weeks. Dr. Dixon is going to email you some of my notes with all of these on there, so you don't need to be writing down the dose rates. I've got all the dose rates and the drugs on that sheet for you. Okay, ear cleaners. So ear cleaners get rid of the wax. They also have a bit of a drying action on the ear canal, so you take away some of the moisture. And they also change the pH of the ear, which makes it easier for the antimicrobials to do their job. So, epiotic, I know you've got available in India. This is a really good one for most cases. It's lactic acid and salicylic acid, and it's acidifying. So it's good for your yeast and good for your cocci and even for your mites as well. If you have rods which are harder to treat, particularly the Pseudomonas, the best one to use is Tris EDTA, which I think is available in India as well. Look up the Indian website. This one is alkalinizing because for rods, they're easier to use in an alkaline environment. There was a question about hydrogen peroxide, whether you can use this as an ear cleaner. I personally haven't. I haven't needed to, but I know in the past it has been used. I think it's just very irritant to the ear canal, so it can be quite painful for the dog. And it's also a risk of ototoxicity into the middle ear if the tympanic membrane is not intact. So I would say you can use other cleaners that would be better. You can even use saline if you don't have any of these ones. If you have to use hydrogen peroxide, I would probably do it under anesthesia or sedation so the animal's not so painful, and use it in that way. And you can also check the tympanic membrane to make sure that's intact before using. Okay, so these are some of the antimicrobials that you have available. And if you have even half of these, you'd be fine to treat most ear infections. Okay, so we've got clotrimazole, this is human medication, clotrimazole and a bit of lidocaine in the ear drop, miconazole, antifungals, Baytril, which is enrofloxacin, gentamicin injectable, flamazine, which is silver sulfadiazine ointment, amikacin, which is another antibiotic particularly used for poultry, and then the dexamethasone, which is your steroid anti-inflammatory. So if you have all of these on your shelf or available, then you'll be able to treat pretty much every infection. And again, I'm going to give you the dose rates later. Okay, so this is an intermission. I just thought I would share a picture of my cat. He's helping me with my presentation. He's actually sitting next to me, behind me as well. So he's part of my family and he helps me do my job. His name is Perchik and he's very old and a bit sad. Okay, so the important principles of treatment I'm going to talk about a bit more than the actual dose rates. The actual dosages. Okay, the first important thing is to measure out the dose. So for a small dog, you want to use about 5.5 of a mil, half a mil, into each ear. Medium dog, about 0.7 of a mil, and in a large dog, 1 mil of whatever you're using, ointment or drops or liquid into the ear. We always send clients home with their ear medication and a syringe, and I'll tell them, please measure up to the 0.5 here and put it into the ear. That's really important. The other really important thing is correct administration. It's really difficult sometimes for owners to imagine or administer the drugs properly, and this results often in treatment failure. So I always show the client how to do it, and I'll demonstrate with the dog sometimes. So in my clinic, we've got this poster on the wall, and I'll usually say exactly this. I'll say, this is a dog's ear canal. The canal goes down towards the ground, and then it turns 90 degrees, and it goes in towards the head. The tympanic membrane is here. This is a sensitive part that we need to be careful of. But if you're putting the syringe directly down towards the ground, vertically, you're not going to do any damage. You're going to wiggle, 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 so you can't go anymore. You're just going to hit the split here, then you're going to depress the plunger, and the medication will go into the horizontal canal and do the job. A lot of people will come in from the side, and they'll come in this direction. They'll touch the split here. The dog will shake the head. The medication will fly out onto the wall or onto the owner or onto the table, and the owner will come back and tell you that the medication didn't work. So it's really important to demonstrate how this works. I also will often show the the client how far down it can go on the syringe, because even in small dogs, you'll be able to get about half of a 1 ml syringe down into the ear. So it does go down quite deep, and often clients are quite surprised about that. So it's good to show them how it works. Usually you'll treat twice a day for about 10 days, unless it's specified on the sheet that they tell you. Morning and night, 10 days, and then the revisit is really important. So you want to check all your cases again in 2 weeks. You want to take another swab and make sure the cytology is negative. If it's not negative, you've got to tell them to keep going with the treatment, and then come back again in either 7 or 10 days, take another swab until it's all completely gone. If they don't come back, then some bacteria or yeast may still be remaining in the ear canal. The animal will seem completely fine, and the owner will think it's gone, but the few bugs in there will replicate. Often they're the more resistant ones, and then the ear infection will come back more resistant and more frustrating to treat. So you need to explain that to the owner and ensure that they come back for your revisit. Okay, so I've got a few drug recipes that will be in the handout that you are going to be emailed. But just as an example, for simple infections of yeast and bacteria, your silver sulfarizine, your flamazine is usually enough. You can dilute it with some saline, or maybe with your ear cleaner, Truth BV-C8, and then administer that to the ear. This is one that our dermatologist in Victoria recommends, and I guess it's a good heavy-duty all-rounder, which will treat your Pseudomonas, your rods, your cocci, and your yeast if you have them. So it's a mixture of disinfectant, chemical, and your using with some saline. But you can go through that later on the sheet. All right, so your job isn't finished when you've cleared the infection. That's only half the job that's done. The other half is to prevent more infections from coming. And the way to do this is to understand why otitis externa happens. Often clients will ask you, often they'll be frustrated and say, why does this keep happening? You know, he comes back with ear infections all the time, and they get frustrated. So even though we've got yeast or bacteria in there, they're not the actual causes of the infection. The primary causes, in most cases, especially in my part of the world, are allergies. Okay, so they're usually allergic to something in the environment called atopy. So it could be the pollen, could be dust, dust mites, could be grasses, and it'll cause them to just be very itchy. They'll scratch their ears, they'll cause trauma, they'll cause moisture to build up, and then the yeast or the bacteria that are already there as commensals will proliferate and cause an ear infection. So with any ear infection, always ask about the skin, ask if they're scratching anywhere else, on the belly, on the armpits, around the tail, on the paws, and if that's the case, you need to address the allergies all over the body, not just the ear. A foreign body is also a primary cause of otitis externa, not super common. And then mites. So ear mites are also a primary cause as well. And then you have these ones as well, which I don't really care about, don't know too much about, which is very uncommon. They can also be primary causes. Predisposing factors, they don't cause an ear infection in themselves, but they make it more likely for an ear infection to occur. So one of these is heat. So in hot, humid environments, which I can imagine some of you are experiencing, maybe at the moment, this makes it more likely for an ear infection to take off. Narrow canals. So if the canal is very small, either due to stenosis, or some trauma, or previous ear infection, potentially, or some breeds who have very small canals, this predisposes them. Can any of you tell me what breeds you have over there? What types of dogs that have really small ear canals? Unmute yourself and we'll type in the chat box what breeds would be predisposed to ear infection.
I think puck.
A pug?
Puck, yeah.
That's right, exactly. One of my least favorite animals to treat ear infections in. Very good. Any other breeds you can think of?
Carriers.
Boxers.
What was that, Cavaliers?
No, I said
Boxers.
terriers.
Cavaliers?
Terriers? The terrier breed?
Oh, the terriers?
Yes.
They can be. I'd say that the pugs are much smaller, but maybe some terriers. I mean, they're just sorry, they're a small dog anyway. Yeah. I don't know how many of you have these. Sharpei, do you have these dogs there? They're also my least. No. Well, good. They're also my least favorite animal to treat because they have so many problems with their skin, with their ears. They've got tiny, tiny ears that flop over, a tiny, tiny ear canal that you can hardly get the swab down into. There's no air circulation there. The moisture gets trapped in there. The wax can't come out, and they always have a chronic ear infection. So dogs like this are terrible. And also poodles or poodle crosses. So these ones don't necessarily have small canals, but they've got very fluffy canals. They've got a lot of hair there that just, again, traps the wax. It doesn't let the air circulate very well, and the moisture can be retained. So they're also good breeds that get ear infections. The moisture, often from swimming or from having a bath, will trap. Will get down to the canal and be a predisposing factor. And then previous otitis externa. So once they've had it once, they're more likely to have it again because there'll often be scar tissue and thickening of the canal. So you have to warn the owner that once they've had it once, they're most likely to have it again. It just depends on when. Okay. So for home care and prevention, you want to talk to them about this. So you want to keep up with your mite and your flea preventatives. So the Advocate and the Revolution, which I spoke about before, we do those monthly just to keep away any parasites which would complicate the ear situation. Ear cleaners, so every 2 weeks, every 1 to 2 weeks usually, just for maintenance, again to dry out the ear canal, to make it a little bit more acidic so that the bacteria and the yeast have an unfavourable environment. Important to tell the client to not use leftover medication. Often they'll say, oh, it was scratching a bit 2 months ago or last week and I just put 1 dose in and then the next day I forgot, the next day I just put another dose in and then it didn't work and now I'm here to see you. So can anybody tell me why that's not a good idea to let the client just use their medication as they like? Why is that not a good idea? Anybody want to unmute themselves and tell me or write in the chat box?
The efficacy must have been reduced.
The efficacy is reduced?
Yeah, lost or reduced. Yeah, we can say that.
That's right. And why is that? What happens to the pathogens in there? The population of the pathogens can cause resistant bacteria. That's right. So the efficacy is reduced because the bacteria that are often left in there are the resistant ones. So with sort of pulse dosing or irregular dosing, we tend to kill off the weaker bacteria or the weaker yeast that are in there, and the stronger ones or the more resistant ones, I guess, will be left behind, and then you'll be left with a resistant population, which then replicates with itself, creating a more resistant population, and then that next infection is really hard to treat. So I usually tell my clients, don't ever do that. If you want to put something down the ear, you can go as much as you like with the ear cleaner because it has no medication in it, but throw away your old medication. Okay, so you can also clip the underside of the pinner. So just shave all the underside here, shave away all the hair, just to get that all away so that, again, the air can circulate better, traps less moisture, particularly in these fluffy dogs. And plucking is a bit of a controversial issue. That's plucking the hairs out of the ear canal. Particularly these poodles and poodle crosses will have a lot of hair in the canal. My take is that I like to pluck, especially if they've had an ear infection. I'll usually just try and pluck as much as I can out. You can use some small alligator forceps or hemostats and gently pull a few hairs out at a time. Most dogs, if you do it gently and with good restraint, they'll let you. Otherwise, you may need to sedate them for that. But in my experience, it is beneficial. There is an argument that plucking the ears can cause irritation to the canals and then cause an ear infection. So if they haven't got a problem, then I won't pluck them. But if they have had an ear infection, then I will. Yeah. And then avoid getting moisture into the ear or water. Okay, so one of my colleagues would tell her clients to use a shower cap over the top of the head to stop water getting into the ears when they took a bath. And so that's good, I think. My recommendation usually is to just put cotton balls down into the ears when you're giving them a bath, just to sponge the head, not to hose the head with a shower hose, and then at the end take it out. But either way, just stopping water getting to the ear. If the dog goes swimming, then it's quite hard to stop water going down. I'll just tell the client to clean the ears really well, dry them up when you get out of the pool or out of the water, and then you can use the ear cleaner, which has a bit of a drying action, to just dry the ear canal after that. And then in severe cases or painful or aggressive dogs, there's a few tips for management. So on some of them, you just might have to put them under general anesthesia or sedate them. If you can't see the eardrum, we usually start with saline, and then you can check it after that to see if it's intact or not. The combination that we use usually is metatominine, butorphanol, and ketamine. Provides quite good sedation to clean the ears. And then after that, I'll usually send them home with some oral sedatives to use before medicating, before the owner medicates at home or before the next vet visit. So the sedatives that we have at our clinic is clonidine, or it's also known as Cataplex as the trade name, trazodone, which I think is a newer drug, or gabapentin, which you may be familiar with for pain relief. All of these are human medications, so you should be able to script them from the pharmacy. Those are the dose rates. I'm going to be talking about these more at my next lecture. So hold any questions or any thoughts about that, and come to my next lecture on the 1st of August, and we'll talk about that more. But basically, the owner will give it 90 minutes before coming, or before they want to give the medication, and that will often just calm the animal down enough to get something down the ear. And then some clients will just need to bring the animal into the clinic for us, the vets or the assistants, to dose once a day or twice a day, depending on how often they can get there. Sometimes animals are just better without their owners around. So what if I can't see the tympanic membrane? So some cases will have such a swollen ear or so much discharge that it's impossible to see down to the tympanic membrane. So I guess what we're worried about is middle ear toxicity. So if any medications or steroids or cleaners go down to the middle ear, they can damage the inner ear and the middle ear and the sensitive hearing. So strictly speaking, I guess some vets will put the animal on oral steroids and maybe just do a bit of cleaning out of the wax, and then get them back in later in the week, potentially, and to see if they are able to look down the ear further. Or you may choose to put them under anesthesia or sedation and clean out the ear so you can have a look. In my experience, I guess I haven't really had a problem with putting medications down into the ear if I can't see the tympanic membrane. So in my opinion, I think it's okay to go ahead with the treatment plan as we have discussed, but it probably pays to warn the owner that we can't see the tympanic membrane. There's a small risk of middle ear toxicity because of this, but I think that the benefits of treating the animal straight away with the antifungals or the ear cleaner or the medication outweighs the risk of middle ear toxicity, and thank God I haven't had a problem yet. I have had 2 cases though in my 10 years where they've come back with a head tilt, but the eardrum or the tympanic membrane has actually been intact. So we sedated them, we had a look. There's definitely no middle ear infection because the middle tympanic membrane was intact, and the head tilt resolved after we took away the medication. So it's not always black and white, and I would say it's probably safe to go ahead and do that. But some other vets may have some other opinions. Okay, so this is my cat again. As you can see, he's my supervisor, and he's supervising me in the clinic doing my x-rays, making sure I'm taking them okay. Just for your viewing pleasure. So often clients will come back and they will say that the medication didn't work and they're very unhappy. So what do we do when there's so-called treatment failure? Well, can anybody tell me if you do culture and sensitivity often with any skin cases or ear cases? Anybody taking the swabs and sent it to the lab, put into culture?
Yes, I do it.
Yeah?
I normally do it. Yeah. If I feel it's not yeast or anything like that, I go in straight away for a culture and sensitivity.
Okay. And do you find many resistant bacteria?
If it is a case that is coming to the second or third time, or it's been treated by so many other doctors and then it's coming, or it is a long-standing case, then we definitely get resistant bacteria.
Yeah,
But if it is a first timer, normally you're able to pin down the problem.
Okay, good. All right, and it's good that you have the option. In my experience, antimicrobial resistance is not common. And I know different populations of bacteria around the world are different. But for us, it's not that common. So I haven't done hardly any culture sensitivity. I haven't really had to. But I think in your case, Dr. Annie, if I had very severe ones, I would probably do one to check. In my sort of setting, the most of the time, the reasons for treatment failure are to do with owner compliance. So they haven't, they've forgotten to dose the dog twice a day, or they've missed some days, or they weren't able to dose them, or owner technique. So they've tried to dose them, but they haven't put it all the way down into the vertical canal. They've just put it sort of onto the walls or onto the outside of the ear or the wrong ear, or they're too scared to push down far enough. So often the technique is to blame. And then a lack of revisit. So many owners don't come back. So we don't actually know if the first infection was ever cleared, or if this is still a one ongoing infection because it got treated, but no one's ever checked to see if the medication was working after 2 weeks. So these three reasons are more common for treatment failure than antimicrobial resistance. So we'd check this first and then probably do your culture sensitivity afterwards. Culture and sensitivity also tends to be quite expensive as well. So we often hold off on that a little bit if we can. Okay. But then you have genuinely difficult ongoing cases, which are hard to control. So techniques for these, so a weekly ear cleaner, and I'll add in dexamethasone. The little recipe is here. 100 to 120 mils of antibiotic or your ear cleaner, plus 40 milligrams of dexamethasone added into the bottle, shake it up, label it, and get the owner to use that weekly or even twice a weekly if possible. So the steroids in there will just reduce the inflammation in the ear canal and stop the animal from scratching and hopefully keep the infection at bay. Often we'll recommend the owner to bring the animal in just for regular ear cleans or plucking of the hair or shaving of the underside of the ear with your assistant or yourself to do some prevention. Ensure the allergies are under control, because from the other slide we saw that allergies are the primary cause of ear infection and the most common. So some animals may need to be on oral prednisolone at a low dose, either every day or every second day, maybe through the itching season, just to stop them from scratching and causing the ear infection. So always address the allergy. It is a possibility to do medication 2 days a week, so either Monday or Wednesday or Friday, Saturday, something like this. I'll put this little sort of emoji there because when I first heard of that, I didn't think it was a great idea because of the resistance that we talked about before. Pulse dosing is more likely to lead to resistant bacteria. This was recommended in a case that I had referred to a dermatologist. So the specialist has recommended this. And it's my understanding that you can do this not to treat the primary infection. You have to make sure the infection is completely gone, but just to keep the commensals at low numbers inside the ears. It is possible for maintenance to put in medication twice a week if you have to. I would treat other things. Ooh, I would treat other things first or try other things first, but this is a possibility. And then if all else fails or you just have severe recurrent infection, then surgery is an option. I haven't performed these surgeries myself, but I have observed one of them when I was at university. So you have the vertical canal ablation, where you take the vertical canal out, and then the horizontal canal is left in, but there's just a much more direct route for the wax to come out. Or total ear canal ablation. So they take both the horizontal canal and the vertical canal out. The animal is left with virtually no ear on the outside, and they seem to be much happier. Can they still hear? The hearing is probably impaired on the side, but they do have their other ear, which hopefully is good. And if they've had chronic ear infections all the time, their sense of hearing probably wasn't very good in the first place. So I don't think they're suffering too much with this going on. And then last tip, puppy vaccinations. When you're seeing puppies and breeds such as German Shepherds that are predisposed to ear infections, I always talk to the clients about playing with the ears, so handling them all the time, giving them treats as positive reinforcement, teaching the puppy that it's okay to have your ears touched, to have your fingers put down their ears, just so that when it grows up and gets ear infections and it comes to you, it's not so scared, it's not so painful and afraid of having its ears touched because it's been used to that since it was young. So that's just something that I like to do with the younger ones. Okay, and that's about it actually. I'll take any questions. Hopefully I'll be able to answer them. Otherwise, maybe some of my colleagues will be able to help me. Just a punt for my next, I'm going to do a next webinar on the 1st of August, so in a few weeks' time. The topic's going to be split between oral hematomas, so surgery of those, and handling aggressive animals. So they're not really related to each other, but I'm going to put two in one presentation, so you're welcome to join for that. And over to you, Dr. Dixon.
Yeah, thank you, Dr. Esther, for a very detailed presentation.
You're welcome.
I think that everybody kind of enjoyed, and it's a real kind of a what do you call that? College session. Thank you so much. This is the time for all of us to ask questions, or you can, if you have some experience in otitis, you can share about that also. Yeah, you can if you can't, if you don't want to ask directly, you can put it in the chat box. Something is in the chat box. Let me see. Okay.
Got a question here. In my practice, how would I rate between ivermectin, selamectin, and moxidectin? Well, to be honest, I haven't actually used ivermectin down the ear for ear mice because it is off-label, and we are a bit conscious of that. So we tend to have to use the ones that are registered for animals first before using ones that are not registered or not registered in that way. The difference between selamectin and moxidectin for me is not much. Both of them do the job really well. So between Revolution and Advocate, there doesn't seem to be a difference in terms of EMI.
Any more questions? Of course, we'll be continuing the session in August 1st, and she will continue on hematoma. Thank you, Esther. Okay.
Yes, please.
Could I ask a question? Do you have a lot of episodes or a lot of incidents of recurrence because of lack of owner compliance or owner technique? Do you have a lot of them?
Yes, all the time. All the time, which is why I'm very firm when I tell them, when I give them the medication, I show them exactly what to do, and I emphasize the revisit. And I'll also write that in my notes, in my history. So when they come back 4 months later and they say it's back again, I say, you were told 4 months ago that you needed to come back and you didn't. And that's why it happened. And I try and make them feel bad about that.
Any more questions?
Dr. Esther.
Hi.
Hello. Thank you so much for the presentation. Actually, I wanted to talk about these aggressive cases, like aggressive dogs. Like last time, I think it was a big boxer came with this condition, and then we sedated and we cleaned it and we gave medication. But then the owner was finding it very difficult to give it at home, the ear drops. So you were suggesting that to bring it daily to the clinic for medication.
That's right. Do you think it would have been better without the owner there? Sometimes they respond better too.
No, like without the owner, we can't do it. Like he was a very aggressive dog, so like even the owner couldn't give the medication to the dog. He wouldn't allow it. It was painful. Like the ear was very inflamed and painful.
Yeah.
So the dog didn't allow for anything to be put inside his ear.
Yeah.
So like, what would you suggest for that?
Yeah, so we do have quite a few of those cases. I guess it's hard, you know, we just have to judge how bad the dog is. But those 3 drugs that I listed there, which will be on your notes, often I'll try that first. There is a bit of a dose range. I've given you the lower end of them, but you can try, if the owner can give the tablet, even with a little bit of food beforehand and before they bring it to the clinic, sometimes it will just take the edge off the dog and he will allow you to handle the ear. I'd also load him up with steroids. So give him a lot of steroids to take down the inflammation, so hopefully it's less painful when you put the ear medication down there. We do have a long-acting, or two long-acting medications that we can put down there, and they last a week. I don't know if they're available in India. I'll send. I didn't put them in my notes, but I'll send the information to Dr. Dist and he can distribute that. If it can be compounded, and so that's another way to do it if you can get a long-acting one. But I think maybe it might be a bit trickier. But yeah, I'll try the oral sedatives first, and then I would also give them a lot of steroids, and maybe even some opioid pain relief, or maybe gabapentin pain relief, just to take down the pain as well. Obviously not non-steroidal with your steroids, but just to take down the pain and see if it will just calm the animal down. Because often they're just quite painful. That's why they're also aggressive, because they don't want anybody to touch their ears.
So you can give oral painkillers along with medication.
You can. That's right. Yeah. I mean, if you wanted to use oral non-steroidals instead of steroids, that would be fine as well. If you think that would be better, just to control the pain, you're welcome to try that one. Yeah.
Thank you.
Any questions?
Debbie has just said that there is one of the long-acting treatments, so that's good. We can, in the chat box, there's a link to the long-acting ear treatments, which may help with the more difficult cases.
So Dr. Annie also has written ceramectin is useful.
Cool.
So note down your.
Oh, okay. So we're not sure if the long-acting one is available in India. Yeah. One day.
Anybody can. Yeah, I don't know, but anyone can tell it's available in India or not? This long-acting antibiotic.
The brand name?
Brand name is Bayer. No. Sorry.
Claro. I haven't even heard of that. It hasn't made it to Australia yet.
Clara. Yeah.
The brand name, I think she's put the contents, the name of the contents inside.
Clara, I think. Oh, Ozernia. We have Ozernia here. It's a relatively new drug.
That we don't have, so far we haven't seen it here.
Right. So when I come to visit India after COVID, I will load my suitcases with Ozernia.
That's wonderful. That's so kind of you. By the way, I didn't tell you, all of you, Dr. Esther has been to India a couple of times. And even she came to Delhi. And she was well accepted. She, because of her features. So, yeah. So it's a.
They even tried to marry me off. That's how accepted I was.
That's very interesting. Okay, any more questions? Anything you want to ask? Anybody has got, or anybody wants to add anything? You are most welcome to do. Experts are here if you want to add any more thing. I mean, hematoma we'll be doing later.
Maybe I can tell you something about our experience in Germany.
Yeah, please.
On the topic, because I've worked in microbiology for a couple of years, and we got a lot of ear swab samples. And I mean, yeast, Malassezia are the most common, but often you've got a mixture of yeast and bacteria. So the bacteria that cause a lot of problems and more severe cases were Staphylococci pseudo-intermedius. So they can also be resistant and be difficult to treat. So then sometimes you don't know. I mean, if you don't do diagnostics or the diagnostic weren't very good, you can have the problem that as a vet, you just don't know if it was the wrong administration by the owner or if it's actually the mixture of bacteria or yeast that's in the ear and growing back. So sometimes what we do here is if we made sure that the owner treated the animal accordingly, that we swap and try to change and to another medication. Often it's a mixture. Cleaning is important, but also the treatment, and sometimes we just need to try out different components. So that's what we do here sometimes. But often you've got those very current cases, and they can be a pain, especially if it's a mixture with allergy and yeah.
Thanks. Denise, which bacteria did you say it was? It was cocci? And it was?
Staphylococci.
Okay, intermediate.
Staphylococci pseudo-intermedius.
Okay, Staphylococci pseudo-intermedius. Okay. Right.
Okay. But I mean, if you've got Pseudomonas in there, it's always difficult to treat. And then resistant cases, I mean, they're always difficult to treat. And if you've got them in there, you can make sure that the owner has a long period of visits in front of them to the vet and coming back and again and again. And yeah, but I think it's important to have what you said is that make sure that the ear doesn't get wet too often. If they have a bath, make sure that the water doesn't get into the ear if possible. Yeah, and the breed is always the first thing I think that you have to make sure. What is the breed, and is the condition so difficult that it will come back again and again? Yeah. I guess that's the same in everywhere in the world, I guess. Yeah.
That's right.
But thanks for the great talk, Esther.
You're welcome. Thank you for joining from Germany.